Welcome again to our Zoom and FB participants to our webinar entitled Cough It Out, Unlocking the Mystery of Cough in Children. I am Dr. Maria Rosa Carmela Chua, Dr. Milay for short, the moderator for this webinar. Starting this year, our webinar series will be called Institute of Pediatrics Learning Academy's Coffee and Conversations. We hope to fill your morning with gems to power up your Saturday morning. So grab a cup of coffee and just relax. But before we start our webinar, please view this video from the Medical City Institute of Pediatrics. Today's Coffee and Conversations is one of the many offerings of the Medical City Institute of Pediatrics Learning Academy. So watch out for this logo when we host our future virtual events. Now, I have my coffee and I am ready for our conversation. First, let me introduce to you our speakers. Our first speaker is the current treasurer of the Philippine Academy of Pediatric Pulmonologists. She's the head of the section of Pediatric Pulmonology of the Medical City Institute of Pediatrics. She's also the head of the section of Pulmonology at the Philippine Children's Medical Center and the current chair of the Department of Pediatrics at the Amang Rodriguez Memorial Medical Center. Please welcome Dr. Emily Resurrection. Hi, Dr. Emily.
Hi, good morning, Milay.
Good morning.
Good morning to all the audience in our webinar this morning. Thank you for the kind introduction.
Thank you, ma'am.
I hope everyone's okay, Milay, after
yes.
the rains and all. It's really a nice time to just sit back and relax and talk
with our
coffee.
And let's invite to our coffee, Dr. Emily, our next speaker, a current consultant staff of the Medical City Institute of Pediatrics. She's also an associate professor at the Ateneo School of Medicine and Public Health and a current member of the Board of Trustees of the Philippine Society of Asthma, Allergy and Immunology. Please welcome Dr. Michelle Joy de Vera. Hi, Dr. Rochelle.
Hi, Milay. Hi, Emily.
Hi, good morning.
I have my coffee as well.
Let's
Hello,
enjoy our coffee.
everyone.
Hi.
And before we forget, she's been introducing everyone this morning and welcoming everyone this morning. But also part of our team is Dr. Nilay Chua. She's a member of the Residency Training Unit at the Medical City Institute of Pediatrics, a consultant staff at the Medical City, World City Medical Center, Jose Delgado Memorial Hospital, Commonwealth Hospital Medical Center, and the Providence Hospital. Thanks again for the introduction, Doc Nilay.
Thank you, Dr. Rochelle, for that kind introduction. It's a nice morning to learn and drink coffee. But before that, doctors, let's say hi to our audience and maybe we can ask them kung saan po sila nanggagaling, no? You may type your entries in the chat box to our audience members and even our audience from our Facebook page.
Especially now, let's say hello to everyone. Here's somebody from Quezon City, somebody from our hood, Pasig.
Si Miss Eunice Luces. Good morning.
Good
Sa
morning.
Pasig.
Ako from Taguig.
Medyo malayo ka, Doctor. How is it there? Is it rainy?
No, not today, surprisingly. Thank you, Lord.
Oo nga.
We've had so much rains and for the past few days, and our
Exactly,
kababayans from the north have been hit really hard.
Nako,
Yeah.
doctors, we have an attendee all the way from Bicol, Miss Patricia Perpetua. Kamusta po kayo dyan sa Bicol?
Good morning po.
Good morning.
Actually, I have a confession to make, Milay and Michelle. I'm actually in Baguio right now. I'm in the north where it's just hit by the typhoon, but it's been
We have
raining. So
our
far, they're okay.
speaker from Baguio.
That's temporarily. I'm not from Baguio, but yeah.
All right. Good morning and thank you to our audience and FB participants for joining us this morning. And before we proceed, may I invite everyone to watch this next video.
Magandang umaga, Maring Marisa. Naku, ang pangit ng ubo ni Junior. Ano bang nangyari? Mukhang naparami ata ng nakain na tsokolate sa party.
Naku, Maring Marites, mukhang nahumugan kahapon. Paano? Naglaro ba naman hanggang gabi tapos natuyan ng pawis? Ayun, hindi na nakatulog kagabi, kakaubo. Grabe, puyat na puyat kami, Mari. Ano bang gagawin ko?
Ay, Maring Marisa, simple lang yan. Pahiram mo lang siya ng menthol rub sa dibdib at sa likod, tapos pausukan mo.
Ah, ganun ba? Eh, yung vitamins at antibiotics kaya?
Triplihin mo lang ang dose ng vitamin C at zinc niya araw-araw at bumili ka na rin ng antibiotics.
Ay, oo nga, Mari. Narinig kong ginawa rin yan ni Maring Marisol. O siya, sige na, Mari. Puntahan ko na muna si Junior.
Ayan. Sa ating audience, nakarelate po ba kayo sa video na napanood natin? Ano po ba ang mga common home remedies na ginagawa nyo para sa mga anak nyo pag sila ang inuubo? You may type your answers in the chat box.
I'm
Daming
sure maraming
suggestions,
nakarelate dyan.
Daming suggestion ni Marites at saka si Marisol. Ano, no?
Oo. Yung ibang parents, oregano. Naririnig ko rin yan, Dr. Emily. Tsaka yung sikat yung ngayon yung menthol rub. From Miss Patricia, water therapy, tsaka lagundi. Lagundi din ang sinabi ni Kila Bulaong.
Meron pa si Eunice, sunbathing daw.
Parang masarap mag-sunbathing ngayon.
Yes.
Maulan pa ata, at least dito sa Quezon City. No? So, ayan. Nako, I'm sure marami pang iba't ibang mga home remedies. Pero okay kaya yon or hindi? Sige, malalaman natin yan sa ating mga experts. Pero bago natin i-discuss yung mga home remedies, tanungin ko muna si Dr. Emily. Doktora, what is cough po ba?
Yes, thank you, Milay, for that question. No? Siguro, first things first, no? Kasi I know that cough, diba, isip natin it's something irritating, it's something bothersome. And especially nowadays, no, magkaubo ko lang, ang isipin kagad ay you have COVID. So kids are not allowed to go to school. They have to stay home. They have to be swabbed to make sure that it's not really COVID. But I'd like you to look at cough in another way. So let's think of cough as the following. It's actually the body's way of responding when something irritates your throat or airway. So kung meron kang maamoy, any irritant such as dust or smoke, it's a reflex action of the body to clear your airways of these things. So the next question is, why do you cough? Now, why do we need to cough? As I mentioned, it's actually the way of the body. It's a self-cleaning mechanism as well as a self-protective response of the body against all of these, I guess, irritants, foreign bodies. Again, it helps clear the secretions. So kaya nga, di ba, pinapaubo natin yung bata. Gusto pa natin ilabas ang plema, no? Para matanggal yung secretions in the body. And sometimes they feel that it helps secrete also or remove the microorganisms from the lungs and the airways. But aside from that, it also helps protect the lungs from aspiration. Kasi lalo kunyari parang masasamid ka, when you cough, at least it doesn't go inside the airway mismo that will eventually lead to a probable pneumonia. So yun lang, Milay and Michelle.
Oh,
And the
thank
audience,
you.
of course, diba? Yeah, you have to remember
Thank
that.
you for explaining what cough is, Dr. Syempre, my next question is, what are the most common or common causes of cough in children?
Yeah, actually, siguro the first thing we need to discuss is about acute versus chronic cough, no? Kasi may cough na sandali lang, acute, or which is about less than 4 weeks. So sometimes you feel or we get worried immediately pag more than 1 week na yung cough, no? But as I mentioned, it's still considered as acute cough even up to 4 weeks. And it can be described or either of the two, either dry or wet. Dry meaning parang wala masyadong plema, and wet is the one which is productive or with phlegm. So going to the causes, so the most common cause, even up to now, for all, I guess for all ages, especially for the young kids, is still an infection. And with this, we think more of the viral infection. So virus lang talaga. So ang virus nga can even last up to 2 weeks. No? So sometimes you really get worried when our kids still have a cough, mga 2 weeks now or a little more than 2 weeks. The other one would be asthma. Asthma, although we always think na dapat hingal, some asthmatic patients can just present with cough na pabalik-balik or cough na on and off, which is also related to allergies, diba, Dr. Michelle? Allergy and asthma somehow, they come together, parang magkapatid sila, magpinsan, magkamag-anak, diba? So,
sama-sama na lahat
sabay.
yan.
Yeah, so, and these two can present as cough. The next one is acid reflux, or sometimes sinatawag nilang heartburn for older adults, no? But acid reflux, although you might think that they will present more of vomiting, in some cases, cough pa rin ang presentation nila. So no matter what medications you give, it will still not resolve because it's reflux. You have to treat it in another way. And lastly is that of foreign body. Foreign body, especially in the younger age group, no? Kung biglang na kain o nalanghap nila yung or pumasok sa daanan ng hangin, siguro ang foreign body, it can also cause coughing, which cannot be usually treated by the usual medication. So with that, if it's foreign body, then iba na yung approach nun, has to be really seen by a doctor, particularly a pulmonologist or an ENT, to be able to remove the foreign body.
Naku, ganun pala yung acute cough, Dr. Emily. Akala ko mga 1 week lang siya.
More, pwedeng up to 4 weeks.
Oh, thank you very much for clarifying that, Dr. Rano. Pero nabanggit mo nga may mga cough na medyo matagal. So, Dr. Rachel, may I ask you about the cough that lingers or that has already a prolonged course?
Yeah, I guess, as we said, if there's acute, there's also chronic. Parati naman ganon, diba? And chronicity is just a measure of the amount of time. That doesn't necessarily mean that it's more scary or more deadly. However, it just means it needs to be checked much better. Kasi hindi nawawala, diba? So as Emily has said, 4 weeks is kind of like that's like the time frame that we're looking at. So beyond 4 weeks, it's considered chronic cough. And that might mean that an evaluation by your doctor, maybe it's time already to see your doctor at that time. So what are the causes naman of chronic cough? If you think about all the things that Emily had said earlier, parang patagalin mo lang yon. Kasi hindi na evaluate, hindi na figure out kung ano siya, hindi siya na appropriately na gamot, it will become chronic kasi nga you're not treating it appropriately. Except for like viral infections, which she said earlier. Kasi viral infections are short generally, diba? Diba, you'll say parang a week, at most a week and a half, and usually it's gone na. Pero like asthma, it's chronic kasi it's recurrent, diba? Ang asthma pabalik-balik, paulit-ulit. That's the biggest clue nga for all of these allergic diseases, allergic asthma, allergic, yung postnasal drip na tinatawag. It's it's all chronic. So asthma can be a reason for chronic cough. Protracted bacterial bronchitis or PBB, that's in especially in more progressive countries. Ito yung pinaka nakita nila in studies na one of the most common reasons for cough, and it's really just a cough where they can't find any other reasons for it. So it's clinically diagnosed. It's usually a wet cough. Yun na nga, sabi natin it's chronic sa mga 4 weeks. There's usually no other signs and symptoms. Ubo lang ng ubo yung bata. And then all of the tests have been done. Walang lumalabas sa x-ray. Ngayon, we have to swab, di ba? Everybody gets swabbed. Tama si Emily, konting ubo lang. Nako, swab na lahat ng tao. And then rightly so. It was a scary thing naman. Now nga, medyo mas ano na tayo eh. Mas cavalier na
diba?
tayo.
Yeah. Okay lang.
Tsaka tinanggal na ng Department of Health ang ating emergency status. So, but still, 'di ba? I think it's important to still get swab, and there are other infections din naman that can cause it. But PBB is something that usually walang mahanap. The swabs are negative, etc. And generally, people get an antibiotic because hindi na nga nawawala, and it will get better generally after the 4 weeks or 2 weeks if you get medications. And then non-specific cough, which, sometimes if you get a viral infection, even though the viral infection goes away na, syempre napatay na, your immune system will kill the virus. But sometimes there's this cough that kind of lingers. It's a post-viral infectious cough. It's kind of hard to decide then, mayroon pa bang iba? People get evaluated for it. Kasi nga, every time na matagal na yung cough, you'll get evaluated. But if nothing comes out, and then there's a story of like, a few weeks ago, mayroong parang trangkaso o viral infection tapos naglilinger yung cough, baka nga non-infectious or post-infectious viral cough. These are other things. These are less common that will cause coughing, chronic coughing in children. Napag-usapan na kanina yung allergic rhinitis, and sometimes if that's not treated, diba, where will the sipon ba go? It's either out here or at the back of your throat. So yun yung post-nasal drip. Diba? So allergies, allergic cough, itchy throat, kaya nagka-cough yung tao. Emily had talked about acid reflux. People, that's one of the most easily missed things, no, Emily?
Agree,
like yung
yeah.
reflux na yan. People don't think that it can cause cough, pero yun pala, all acid pala, micro-reflux. That's less common, obviously, in younger children, but in older children or in adolescents, baka pwede na yan. Kasi stress.
And it can aggravate the asthma, diba, Michelle? The reflux can aggravate the asthma.
Correct. So parang dalawa na ngayon ng reasons niya. Meron na nga siyang reflux, may asthma pa siya. It's also important to point out indoor pollutants, lalo na at the time when we all got stuck at home. Buti na we can get out already, but indoor pollutants, especially tobacco smoke or cigarette smoke, we cannot emphasize this enough. It's not just cough that cigarette and tobacco cause, lots of other things. And so if you're a parent or if you're a caregiver of children, maybe better to stop smoking na rin. But that's another coffee and conversation.
Yes.
And then outdoor pollutants as well. So kasi lumalabas na yung mga tao ngayon, there are more cars. Diba? Bumabalik na naman, traffic is bad na naman. So car exhaust, particulate matter, pollutants in the air. And we talked about this earlier also. Foreign body, pag hindi na-diagnose kaagad yon, hindi pumunta agad sa hospital or sa ER as what Emily has said, hindi nakita yung pulmonologist or hindi nakita yung ENT. And it wasn't so bad, it's just subtle, but it can linger. And so the longer it is, the longer the cough, might be a good time to take a look at your doctor. And another really bad stuff, like interstitial lung disease, which are less common, or chronic pneumonia, recurrent pneumonia. These are things to think about. But the key here is that the longer it is, the more important it is to see your doctor so that all of these things can be ruled out or evaluated. And some tests can be done, in fact.
Nako, Dr. Rachel, medyo commonly na discuss yung or nababanggit yung allergy and asthma, and since you're perfect speaker for that topic,
Right
since you're
person.
an allergy doctor, isn't it difficult to differentiate allergy versus an infection such as the common cold? And magpapasok ka na ulit, and although the Department of Health has lifted the emergency status, I'm sure meron pa ring mga kakaba-kaba sa mga inuubong bata.
Oo
What
nga,
do you
that's the million-dollar question.
And you will answer it today. You will answer it today.
Yes, I will try my best. Ayan. So I think it's difficult. I think especially since the signs and symptoms can be very similar. There are some obvious signs and symptoms. So for example, fever. Fevers are like number one clue, right? Allergies, very, 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 very walang fever yan. Extremely unlikely na magka-fever if you have allergic cough. Unlike infections. Generally, if you have an infection, whether it's viral or bacterial, you get a fever. That doesn't mean, however, that if there's no fever, there's no infection. Diba? Some people have a common cold and they don't have a fever. But generally, if there's a fever, infection yan. Other signs and symptoms of infection usually will go with the cold, right? For example, if you have the flu, right? So you're achy, parang matamlay, lulugo-lugo. You have other signs and symptoms like headache, you're tired, yung mga ganyan. So generally, those things might tell you that it's really more a cold or an infection rather than allergies. Certainly naman, you can have headaches with allergies, especially, di ba, if your allergic rhinitis is so bad, tapos nabara na lahat ng sinuses mo, and you have sinus headache or sinus pain or sinus pressure, that happens. But that would mean that your allergies are so amazingly uncontrolled that can cause all of these things. Fatigue sometimes can happen with allergies because you don't sleep well. So if your allergies are bad, ubo ka ng ubo sa gabi, or if you have allergic asthma, ubo ka ng ubo sa gabi, or your nasal passages are very congested and you don't sleep well, syempre, if you don't sleep well, you're going to be tired the next day. But generally, fatigue and headaches and all of these other constitutional symptoms go with the cold. Medyo dun tayo, plus the fever. With allergies, there are usually other signs and symptoms of other allergic issues. So like, di ba, people have allergic conjunctivitis, itchy eyes, watery eyes, itchy, very itchy nose, mga ganyan. Or you have other allergic disease. Some people have atopic dermatitis or skin problems. So it's also important to take a look at the person as a whole or the child as a whole. Hindi lang yung cough. Diba? Kasi when you go to the doctor, diba, that's what they're going to do. Milay, Emily, diba? They'll ask for a lot of other things, your history, etc., etc. So the more chronic, the other signs and symptoms of allergy, so baka allergy yon. Tapos, generally, pag cold, or which is virus kasi ang pinaka-common, it's short. A week and a half, at most 2 weeks maybe. Medyo matagal na nga yung 2 weeks eh. But generally, it's short. It will go away on its own. Allergies, on the other hand, on, off, diba? Parang forever and ever. Parang sipunin na lang ang ating mga children paulit-ulit without any other signs and symptoms. And as Emily has said kanina, diba, yung mga taong may viral infection, madalas yan for children, diba? How often na nga, Emily, would you get like viral infections?
Yeah, in a year, maybe about 6 to 8 times. That's still normal in a year.
Diba? So 6 to 8 times, diba?
Yeah.
Tsaka Dr. Rachel, di ba yung pagka may pagbiglang summer or pag Christmas na inaatake na ng mga sipon yung mga may allergy?
Correct, like more seasonal. Pag may mga pattern na ganon, you see a pattern, you see it in seasons, baka more allergy rather than colds. So although maraming beses, like 6 times, 6, 7, 8 times in a year, you'll get a viral infection, mas madalas pa din doon ang allergies. So ang allergies parang every week. Parang gano'n. Parang hindi na nawala.
Nako, thank you, Dr. Rachel, for clarifying. I think meron din akong allergies eh. Now let's
Yeah, but in reality, di ba, Michelle, sometimes it's hard. It's hard to differentiate.
Very hard.
But if it's when in doubt, syempre our audience or our parents, maybe you should consult already a doctor if you're not sure if it's allergy or a cough.
Ayun nga. So Speaking of consulting the pediatrician or the doctor, now tatanungin ko po ang ating audience members, doctors, when do you consider going to the doctor pag sila ay inuubo na? Ilang araw po ninyo bago sila dalhin or patignan sa doctor? You may type in your chat box, your answers in the chat box.
Nako, interesting yan. Ano kaya ang mga lalabas na sagot? Kasi I'm sure yung iba,
Iba-iba.
bibo.
Oo. Si Miss Patricia, Miss Patricia, thank you for being an active participant in our discussion. So sabi ni Miss Patricia, 2 to 3 weeks.
3 weeks.
And si Miss Ritzy, 3 days.
Iba-iba. Yeah.
Iba-iba talaga, no,
Ang
Doc?
dami. Oh, ayan, 1 week, 5 to 7 days from Ma'am Stephanie.
Oo. So, maganda na na-discuss natin ito, lalo na yung mga time frames, ano? Okay. Let's tell our audience, Dr. Rachel, ano ba yung mga dapat nating bantayan or things to watch out for para malaman natin na ito kailangan na silang dalhin sa doctor?
I think the time frame is important. I think, like we said nga, di ba, the longer it is, di ba, pag 4 weeks, obviously that makes sense kasi it's not getting any better. But I think aside from the time, kasi everybody has different, comfort zone din yan, diba? Like I'm a little bit worried, I'm a parent, I'm more worried, and which isn't wrong or right. It's just really more comfortable for the parent or the caregiver to bring their children to their doctors. But aside from the time, it's also important to look for other parang red flags, yan yung tawag natin, diba? So we can either take a look at the history, like what's the kwento? Like what's the kwento with the cough? And also, what are the parang physical findings, like signs and symptoms? So in the history, there was somebody had said here, like si Ma'am Ruth said, if it's severe, that's true. Let's say the cough is really, really severe. And when we say severe, what does that mean? Kunyari na affect na yung daily life of the child. Or look at this, difficulty of breathing, hindi na siya makahinga. Also, I think it would be considered severe if the cough is interfering with feeding or meron ng problems with vomiting or they can't swallow anymore kasi cough, 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 cough. Hindi na natapos yung cough. So I think the more severe, with all of these symptoms, I think it makes sense to see your doctor. Other signs and symptoms that we need, other kwento in the history that we might think about would be like if they're losing weight, diba? That shouldn't be normal. Weight loss is not normal. So if your child is losing weight or not gaining weight, like hindi nga siya naglo-lose, pero hindi naman siya nag-gain, parang nag-fail na siya mag-thrive, that might be something to think about with the cough. Other things like bloody phlegm, that I think that's fairly obvious. I think all of us, pag nakakita, oh my God, my phlegm is bloody, ay punta na yan sa ER. The younger the child, the more important to maybe see your doctor, because if you're a neonate, like less than a year old, less than 6 months old, less than a month old, they can't say it, diba? They can't say anything. Hindi naman sila magsasabi sa'yo what they're feeling. So it's important. And sometimes the signs might be not very characteristic, maybe not very, it might be subtle. But here are some really non-subtle signs. So yan, kunyari, clubbing. Clubbing means when you look at your nail beds, ayan, para yung picture dyan. Pero yan, medyo extreme yan, no? Diba? Pagkita mo, talaga namang parang clubbed yung kanyang mga fingers or fingernails. That's really a sign of chronic lung disease. So matagal nang may sakit, matagal nang may lung disease yung patient or yung child, kaya naging ganyan na yan. There's very, very poor perfusion na kasi. We talked about failure to thrive, hindi na nag-grow or losing weight. Certainly, if you look at the chest and they look abnormal, the shape looks abnormal, or when they breathe, it looks abnormal. So I think that's a good time to see your doctor. If there's any abnormalities in like their voice or parang hoarse na sila all the time, or like when they cry, weird na yung ang sound ng cry nila, or anything that looks like they're in distress, using a lot of their muscles, breathing. Yung sasabihin ng mga ibang pasyente natin, parang umaalon. Diba? Umaalon daw yung tiyan. Or
umaalon, yes. Or abdominal breathing. Agree.
Diba? Abdominal breathing yun eh. So maybe that's something to think about. So all of these things, aside from the time frame, like totoo naman, tumatagal, masyado nang matagal the cough, plus all of these other signs and symptoms. In fact, even nga, somebody had said here, a few days. That's true. A few days nga, pero respiratory distress naman siya. Diba? 2 days pa lang, pero you're looking at the child and it's having such a hard time breathing, then it's time to see your doctor. So these red flags are important to think about and to look for in your children or in our patients actually, and then see them.
Thank you very much, Dr. Rochelle. And Dr. Rochelle, very important to discuss these findings on mga symptoms and signs. Kasi maraming nanonood sa atin. No? I see some participants who we know personally. We have doctors, colleagues of the institute attending. No? So even mga doctors nagre-review kung ano ang mga bantayan sa ubo. So very timely ang ating webinar. So we have doctors, Dr. Aparas, Dr. Alcazaren. These are members of our institute. We also have Dr. Ruth. Doc Ruth, long time no see. And we have friends, si Ritzy, yan. Mommy din yan kaya attending the educational webinar for this morning.
I think we're all doctors, but a lot of us are also moms.
Yes.
Sometimes, di ba, magkaiba yun?
And it's different if you're the mom. You're not the doctor.
Doctors, I'm sure the doctors in the audience would also relate to when your child gets sick, your doctor license flies out the window. You are mommy.
God, yeah.
Yes.
Buti na lang madaling mag-call a friend. I will call Emily. Hello, Emily.
I'll call Dr. Rochelle and Dr. Emily.
I will call another friend.
And doctors, meron din tayong mga entries from our FB Facebook participants. So regarding yung kung kailan nila dadalhin yung mga anak nila for consultation, iba din, no? Merong 3 days, merong 5 days. So I suppose depends din kung ano yung nakikita nila sa mga anak nila. And there's no other person who knows their child better than the parents or the caregivers. All right. Thank you very much to all our participants for your entries. You make our discussion even more livelier. Pero, naalala niyo po ba itong dalawang magkumare? Kanina, pinag-usapan nila yung mga causes ng ubo ng anak nila, si Junior, pati yung mga home remedies na naisip nila. So, tatanungin natin ang ating mga experts, no? Si Dr. Emily and Dr. Rochelle. Dr. Emily, ang una ko pong itatanong sa inyo ay nakakakos ba talaga ng ubo ang nahamugan or ano pa yung common? Natuyuan ng pawis.
Natuyuan ng pawis. Yan ang lagi natin narinig. No? Usually, that's the usual concern yata ng mga lolas and lolos. No? Sinasabi sa mga nanay, no? Huwag matutuyaan ng pawis sa likod. No? Pero actually, siguro for me, Michelle, if you'll agree with me, or Milay, di ba? Minsan ang mas concern natin yung pag-change ng weather. Especially kung asthmatic, di ba? Yung malamig, tapos yung init. Yun talaga pwede mag-trigger ng cough in an asthmatic. Pero yung pagtuyo ng likod and all, siguro it's more of, kung talagang tuyo, may pawis na yung likod and all, di ba? Di ba may mga bata rin nalagyan ng dyaryo sa likod, di ba? Dyaryo or towel sa likod. Yes, towel.
May dyaryo pa ba ngayon?
Dyaryo dati, dati pa yata yung sa likod. So, ang sinasabi ko lang, di ba, parang mas mainit pag nandun siya sa likod. No? So, I'd rather na kung nabasa ng pawis, siguro magpalit ng damit. I think that's the best solution to do. And then yung change of weather, kung talagang yun ang cause ng ubo niya, dahil asthmatic siya, then I guess baka kailangan talaga ng gamot. Wala tayong choice. Bibigyan ng usual medications yung mga asthmatics kung ganun sila ka-sensitive with regards to the change of weather.
Thank you, Dr. Emily. Dr. Rochelle, ito, madalas ko din itong naririnig sa kliniko and unfortunately, favorite ko to, no? Yung chocolates. Na parami ng
chocolate. Masarap.
Oo nga. Milay, bawal ka na mag-chocolate.
Wala po akong ubo.
Yung chocolates, I mean, how do I say this? It's not true for everyone. I think chocolate can be an irritant. Kasi di ba, pag ang dami mo nang kinain na sweet stuff, not just chocolate, but other things, it can irritate your throat. Kasi di ba, it's sweet, it's medyo yung texture niya. So I think it's really more an irritant rather than a true cause of the cough. So kunyari, pag ang dami na uubo. And generally, if you just take a lot of water, di ba, you clear your throat, you gargle, you brush your teeth, it's probably going to be good. So hindi naman bawal. Hindi rin bawal na parang, lahat kayong umuubo ha. bawal na kayo mag-chocolate lahat. Hindi rin naman totoo yun. Paano kung hindi naman ako affected by the chocolate? And eventually, you'll figure it out, right? You'll figure out like, oh, these things irritate my child when they cough. Tapos mapapansin mo na yan. Parang, okay, pag umuubo siya, ito na-irritate talaga yung throat niya. So, wag muna, diba? But there's no parang hard and fast rule about it. So, yes, hindi pa tayo bawal mag-chocolate lahat.
Pwede na
Pero
ako.
kung pipili ka ng, oo nga, pwede na. Pero kung pipili ka ng chocolate nila, yung masarap.
Oo, para sulit yung ubo.
Para sulit.
Joke lang po yun, ha? Oo. So, ayan. So, ngayon naman, doctors, pag-usapan natin yung mga napag-usapan nila na remedies. Yung mga sinuggest ni Maring Marites. Unahin natin yung menthol rub. Dr. Rachel, any input po?
Oo nga si Mami Marites ang daming ang daming input, 'di ba? So
Suggestions,
daming suggestions. And I think that's true naman for everyone. Cough is such a common thing. Ang dami-dami talagang mga suggestions sa cough. Pero ang menthol rub, I think the first thing we have to establish is that there's no very, very strong evidence about menthol rubs. Parang wala kasing magandang studies, yung mga studies na ginawa, hindi naman nagpakita na people who use the menthol rub significantly affects their cough. That being said, some people like the smell. Diba? Pag nilagay, even when I was a child, my parents would put like menthol rub on my forehead, on my nose, chest.
Yeah.
Saan pa ba? Like, paa, di ba? Parang you're
Lahat.
smothered in menthol rub na, di ba? Parang, here, mag-menthol rub ka, parang ganyan. So, parang, and, I didn't mind. I like the smell. Although, yun na nga, whether it works for the cough or not, baka hindi. Baka some people just like the smell. And we have to be careful about that. Kasi, di ba, there are problems with inhaling all of these mga strong scents eh.
Yes, no? Masyadong the one they call lipoid pneumonia. So we've had cases of that, no? Parang na-aspirate nila yung oil itself, so it causes lipoid pneumonia. So really have to be careful when using it too frequently. So talagang ingat po tayo.
Oo. Tsaka wag siguro nating ilagay sa loob ng nose.
Dito.
Parang siguro, 'di ba? Dito linalagay, oh. So wag naman siguro. So you can use it, but I think we have to be careful about it. And not just lipoid pneumonia, but also I know some patients who have asthma.
Yeah.
If they smell like very strong, kasi some of the menthol rubs can be very strong. So if they have very strong scents or strong smells, minsan nati-trigger yung kanilang asthma or allergic rhinitis symptoms. Yeah.
So parang counterproductive pala, Doc Shell, no? Ayan. So next na napag-usapan is yung pausok. Dr. Emily, can I turn to you?
Thank you. Yan ang favorite ng ating mga pasyente, no? Pausok, no? Iba-ibang klase, di ba? Ano tawag nila yung suob ba yun? Suob yung parang steam lang, di ba?
Parang steam.
Parang steam inhalation.
Yeah, which became popular especially during the COVID pandemic, the start of the COVID pandemic. And then of course, there's the nebulizer itself, no? So remember kasi when you use all these machines, whether steam, suob, vaporizer, and all, ang purpose kasi niya is yung medicine itself or yung water makes it into smaller particles so it go lower to the lower airways. Siguro ang gusto lang natin mag-ingat lang po tayo, maging maingat. Yung paggamit lagi ng mga gamot, yung tawag namin na bronchodilators, no? Tulad ng salbutamol, na usually we give for patients who really have asthma. Kasi nagiging tendency kahit anong ubo, naka-salbutamol na siya, di ba? So that is important kung asthmatic. Kasi remember, marami ring side effect yung mga gamot na yun. It can cause yung mabilis palpitations, iba nagte-tremors when they use this medicine. So in some instances, pwede nang gamitin lang yung normal saline. Diba? The normal saline will help, or NSS na tinatawag, it will help parang to loosen the phlegm para mas malabas natin yung phlegm ng mga bata to expectorate. But if you're going to use the steam or yung mga suob kung sakasakali, para dito na yung sa upper airway. So maganda siya, lalo na kung merong sipon, di ba? Baradong ilong, no? Kaya lang ingat, kahit nakape, di ba? The steam of the water, from the coffee or from water. Pero syempre, as always, ingat lang po, lalo maliliit na bata, di ba? Kasi baka matapon, tapos magkaroon ng burn, no? Madoble pa yung problema ng bata, and not just the cough or the cold itself.
Yeah. Iba na ang problem niya ngayon.
Yes.
Mas matindi na.
Burn victim na siya ngayon.
Yeah. Thank you, Dr.
The other thing about that, yung parang when you steam in the young kids, because kasi a lot of them don't know how to blow their nose. Diba? They don't know how to blow their nose. They don't know how to to
Yes.
expectorate. So sometimes with
Expectorate.
the steam, dahil sobra ng watery nung kanilang yung kanilang mga
Secretion.
sipon,
Yeah,
yeah, and
sipon.
their secretions, nagiging ano na lang, it's easier for them to get rid of it.
Yes.
All right, thank you. What about triple dose daw po ng vitamin C and zinc? Dr.
Ada-
Rochelle,
Oo
what
nga,
can you
the,
say?
the dictum is too much of a good thing might not be always good. So like
Agree.
mega
Agree.
doses of vitamin C or zinc. I mean, certainly in the right amount, these things are very good. They're vitamins and they're very useful. Pero some people kasi, di ba, parang sabi, oh, may ubo ka. Imbes na 1 tablet lang of vitamin C ang inumin mo,
Double.
2
2
tablets or 3 tablets of vitamin C. And people will say, vitamins lang naman. Diba, how bad can it be? Or vitamin C is in fact a water-soluble vitamin. So sasabihin nila, oh, you're gonna spit out. Diba, yung bibi mo lang yan. But that's not true. There's vitamin C toxicity. People have had problems with it. You can get, like in the older population, you can get like stones, like kidney stones from too much vitamin C. So it's not innocuous. It's not like parang sige, go for it, parang ganyan. Aside from the fact that on its own, it's not like if you take vitamin C, hindi ka na magkakasakit. That's not true either. It's a great vitamin. I mean, we love vitamin C and it's important. But it's not like parang, sige ha, if you take vitamin C, hindi ka na magkaka-cold, so magkaka-COVID. Di ba na ano rin yan noon? Yung nung nauso yung naging pandemic ang COVID, everybody they were taking all sorts of vitamin C. So it's good to take one. It's not a problem. But yeah, I wouldn't probably overtake the vitamins.
Yeah.
Yung mga the recommended daily allowance of
Yes.
your vitamins, that's what you need.
So we have to remember pala, no, too much of something is not good.
It's not good. Yes.
Oo.
Even chocolate, Milay. Even chocolate.
Oo nga, ano ba yan? I have to remember. All right. Dr. Emily, kanina nabanggit na po ng ating mga audience members itong oregano and lagundi.
Yes, no. Actually, those are the most popular siguro na herbal medicine. No? For us doctors in the audience, I know if you've been familiar with one of our pioneers with regards to herbal medicine is Dr. Maramba from UPPGH. No? So there's been several studies done now on the use of lagundi. No? Lagundi nga, but it's easily available in the market right now. There's the liquid preparation, there's a capsule. And I know nung time, lalo na the height of the COVID pandemic, diba, favorite din siyang ibigay. I know that it's been soothing.
Yes.
Soothing daw when you take the syrup of the lagundi. As I mentioned, marami ng studies na ginagawa. And I think it's been used also for asthma. No? So I have you can use it again, as always. So when you use it as a first aid sa mga anak ninyo, kung hindi talaga nag-i-improve, o sabihin natin lalo, wag naman nag-worsen, syempre mag-consult na sa doctor. With regards to oregano, I'm not aware. I don't know if anyone in the audience is aware of a readily available preparation ng lagundi. Wala yata, di ba? Usually ginagawa yung mga nanay, ng mga lola, di ba? And I know that ang purpose niya, kasi ano po masama daw ang lasa, sabi ng mga patients ko na bigyan, no? Para lang maubo or malabas siya, masuka yata ang plema. No, siguro I guess okay lang 'yon, pero ingat pa rin. Siyempre again, pag sumusuka ang bata, ang ayaw natin mangyari is mag-aspirate naman sila.
Yeah.
So with that, if they aspirate, papasok sa loob ng lungs, so it will even become worse kasi lalo sila magkakaroon ng pneumonia. So again, with the use of herbal medicines, there are some that again, like especially lagundi, can be used. It's been recommended, but as always, know when you need to consult your doctors.
All right. Thank you, Dr. Emily. And I think naging uso to, Dr. Rochelle, and I am throwing this question to you as an allergy doctor about essential oils.
Oh, yes. The oil du jour these days, parang ganyan. Yet again, same thing with those menthol rubs and mga camphor, mga ganyan-ganyan. There's different kinds of essential oils na now,
Yes.
diba? And it's very specific pa. Like if you have this cough, it's this essential oil. If it's asthma, it's this essential oil.
Yes, Doc.
Diba? Parang gano'n. Very specific na rin sila. But I think like most of the complementary medicines or complementary therapeutics that we have, there's very little strong scientific evidence about essential oils. Same thing with, as Emily was saying, I don't think if it's like, diba, you put it in like parang like a diffuser, Ganun yan,
Diffusion,
di
yeah.
ba? Mga ganon, they smell it, parang ganon. I think generally that should be okay. I mean, what's the harm? People will say, what's the harm? That's true. But yes, make sure that you don't inhale it directly. That might be something that might be more dangerous. And yet again, some people have aversion for very strong smells. So kung yung mga kinds of essential oils na ginagamit ay very strong or very pungent, baka some people might actually get irritated by it. Same thing with all of these mga complementary therapeutics. You take a look, like, is it working for you? Is it what are the risks involved with it? If it's very minimal, the risk, maybe you can try it. If it's not working or your cough is getting worse, I think it's important to talk to your doctor about it. I think also, speaking of like taking things by mouth, like oregano and stuff, when you go see your doctor, also tell them about it. Kasi di ba when your doctors ask, may gamot po ba kayong iniinom? Nobody thinks that herbal
Complete
medicine.
disclosure.
Oo, yan, tama, full disclosure. Parang ganun, di ba? Tell them what you're taking. Because, sometimes if they give a medicine, we don't know. There might be some interactions between the herbal medicine or the complementary medicine or whatever you're doing with the prescription medicines that your doctor will give. So, ano yan? Pag nagkwento kayo, kwento na lahat. Game na.
Oh, thank you,
Agree.
Dr. Rachel. And also, I'd like to invite our audience members. If you have questions, you may type them in the chat box so we can also discuss. In the meantime, Dr. Emily, I will ask you about this last but not the least, and another common remedy po, yung antibiotics.
Yes, no? Actually, it used to be, di ba, parang ang iniisip ng mga tao is the treatment for any disease, especially cough, is usually antibiotic agad. But as I mentioned, the most common cause pa rin of acute cough is still a viral infection, which means virus siya, hindi mag-work ang antibiotic kahit na ibigay mo lang for a long period of time. And aside from that, syempre, if you start giving the antibiotics early on, tapos viral pala siya. Pag nagkaroon ng bacterial infection, mas malakas ng antibiotic ang kailangan mong ibigay. Siguro the nice thing about nowadays, di ba, dati, you cannot give an antibiotic unless you consult your doctor. So, which is in a way good. But of course, we do hear of patients, di ba, nangyayari, binigay sa kapatid, so ibibigay na rin doon sa kabila. Di ba, may tira pa eh.
May tira.
Ibibigay ko na, di ba? Or may standby antibiotic from the last consult. So they will use that this time for this consult. So just be careful again. If you give antibiotics and it's not necessary, it may be eventually harmful to this patient.
All right. Thank you, Dr. Emily. We have a question from the chat box. So Ms. Rose is asking or concerned po, no? My daughter is 5 years old and I brought her for check-up with 2 doctors at nabigyan na po ng antibiotics pero inuubo pa din daw po ang kanyang daughter and it's been more than half a month. So I suppose
Sana hindi kami yun, Michelle, no? 2 doctors, baka you and me yun.
You and me.
No, I guess, if I may, Michelle, no? As I mentioned,
please.
no? See, this patient was given antibiotics and they still didn't respond. They're still coughing. So most probably it's not a bacterial infection. It's something else. Could be asthma, allergy, maybe what else? Reflux, diba? All the other differentials that we mentioned. So Michelle?
Oo, kasi like Ma'am Rose is saying, it's been half a month.
Yeah.
So it's been, and even worse, it's not getting any better. So diba we talked about those red flags, and more than the amount of time, it's also the things that are going on aside from the cough itself. So I guess if you haven't followed up, I think that's also an important thing. The doctors that you've consulted, maybe it's also good to let them know, follow up with them and say, doc, binigyan nyo na siya ng antibiotics and yet she's still coughing. Because your doctor might also say, oh nga, no, I've given you antibiotics and I'm going to think of something else. That's another good tip. Like if you see your doctor and they give you something to do, it's also good to follow up with them so that they actually know what happened. Because sometimes like this one, maybe they thought it was a bacterial infection talaga when they saw your child, and when they did the examination, they thought it was a bacterial infection. And so they were thinking, okay, I'm going to give you an antibiotic and you'll be fine. But if it didn't get better, go back and see them. That might be something important.
And maybe it's time to work up, diba? Maybe
other laboratory tests.
Yeah, X-ray or whatever. All the other tests can be done.
Thank you, doctors. Again, you may type in your questions in the chat box. And to our Zoom participants, you can also post your questions. Speaking of Facebook questions. Ito, Dr. Shell. Na pabalik-balik na cough. Di ba na-mention niyo po yan kanina? Pabalik-balik na cough in a 7-year-old boy. So I suppose yung mga concerns really yung pabalik-balik ngayon, no? Lalo siguro ngayong tag-ulan.
Oo. So if you, ma'am, for our audience who's asking that question, if you go see your doctor, they will ask about other things. So ano yung mga kasama ng cough? Yung pabalik-balik na cough. Cough lang ba? When does it happen? Is there a pattern? Mas madalas ba sa gabi? Meron bang ibang symptoms na hinihingal ba siya? Meron ba siyang runny nose? Things like that. All of these things will help your doctor decide where to go. Parang allergy ba to? Asthma ba to? Kasi yung pabalik-balik, parang hindi nga infection, 'di ba? Like kasi pabalik-balik. Unless obviously pabalik-balik doc pero may fever parate. So that would be different as well. So maraming possibilities. Allergy certainly and asthma, all of these recurrent diseases can happen. But it would be important to ask about other parts of the history. Yung ibang parte po ng kwento, 'yon tatanungin ng doctor niyo 'yon.
Ayan. So I hope Ms. Tin Domingo, who asked that question, was able to get a clarification. We have another Facebook entry. Ito, Doc Emily. Direct ko na sa'yo. Salbutamol was given for 5 days, but cough is still not resolved. Should it be extended?
Oh, again, it depends, no? Kasi nga, if salbutamol is given, number one, asthmatic ba siya? Diba? If the patient is asthmatic and on salbutamol and still not responding, might need something stronger like maybe a steroid. Diba? Kasi nga, when the asthma is getting worse, especially if talagang having an asthma attack, steroids still are being given aside from the bronchodilators or salbutamol. So it needs to be really assessed. If in doubt, 5 days already on salbutamol, consult your doctor. I think that's the best thing to do to make sure.
Okay, Ms. Wynn, I hope you'll be able to go back to your doctor para ma-confirm if may asthma siya or not. And then we have some questions here sa ating Zoom, a webinar chat box. Okay, from Miss Joyce. Hi, good morning, doctors. Just a frequent question in the clinic. May I know your opinion regarding mucolytics in the younger population, especially for less than 5 years old, or cough medications in general?
Sa akin na ba yan? O, kaming dalawa ni Michelle. No, kasi nga, siguro
mucolytics daw, Doc. Kasi ano yan, di ba? Over the counter yun, Doc.
Over the counter, no? There are so many kinds. May mucolytics, antitussives, di ba? May expectorants. No? Well, theoretically, if you look at studies, supposedly parang they don't really have significant effect with regards to the treatment of patients with cough. But again, I guess, di ba, mayroong mga anecdotal, no? When they took this medicine, they felt better. Again, remember when they do studies, you'll try to see more scientific, di ba? The effect itself, if it shortens the duration of the cough. But siyempre, as parents, as doctors, you want your patients to be relieved or else hindi na babalik yung pasyente sa'yo, no? But I just want to suggest that you be careful when you're talking about the younger age group, no? If you give them like mucolytics, you give a patient less than 2 years old, tapos hindi naman marunong mag-expectorate, sometimes it even makes it worse. So I'd be careful when you're giving all these medications. I guess case-to-case basis, no? Even antitussives, no? We think that dapat to stop the cough. But as I mentioned, no, it's a way of the body to protect the lungs from any irritant, and also hindi natin kailangan to stop the cough. What's more important is to address the cause of the cough.
All right. Thank you, Dr. Emily. Thank you, Dr. Joyce, for your questions. And we have a similar theme of question from Ira and Amelia. Differentiation of, ito ulit, review na lang natin, Doc, siya, no? Allergy versus asthma and primary complex, and yung activity-induced asthma. Paano ba natin yun?
Okay. So, as we said earlier, so yung allergic rhinitis and asthma, yun medyo parang magkamag-anak. Kasi if you know, like if you have allergic rhinitis, the risk of a person having asthma is also higher. Kasi they're kind of all dugtong-dugtong, di ba? And it's all allergy. So, but that being said, allergic rhinitis is really more upper airways. So parang runny nose, sneezing, like that post-nasal drip. And then asthma is really more lower airway. So difficulty of breathing, chest tightness. Cough can also be a symptom of these things. So generally, if you go to your doctor, they'll ask about these questions. So, ano ba yung symptoms? Puro ba dito? O kasama na to? Parang ganon. Or umuubo ka kahit wala kang rhinitis. So, baka nga mayroon ka ng allergic rhinitis at mayroon ka pang asthma. If you're older, there's certainly better tests. There are breathing tests. It's called the spirometry that you can do so that if the suspicion is asthma, that test can add more information to your doctors and say, oo nga, asthma. If you're thinking allergies, we can certainly find out if you're an allergic person. So if you're highly, highly allergic, baka nga naman allergic rhinitis. Primary complex, that's tuberculosis, I would assume. So that's primary tuberculosis. That's different as well because that's an infection. And generally, if there are other signs and symptoms in children, for example, weight loss of appetite, activity issues, your doctor will ask about these things. Sometimes fever, but remember in the younger kids, iba yung storya nila, iba yung the way they present with tuberculosis is different from an adult or an older child. So it's important for you to talk to your doctor about it. Also, they'll ask about exposures. Meron bang may TB sa pamilya? Parang ganon. So, yun ang mga differences nun. Si activity-induced asthma, that's in the olden days, they used to call it exercise-induced asthma. And still now, it's still found in literature. Generally, they'll say it's because when you play sports or when you're running around, then you get asthma symptoms. It's very rare that that's the only problem you have. Generally, and I'm sure Emily will agree, hopefully Emily will agree with this, it's really the person has asthma. And then it's not very well controlled. And so therefore, the exercise triggers the underlying problem of asthma. So when you talk to your doctor, they'll say, they'll review everything else. So, really ba, pag sports lang ba, tsaka siya nag-asthma? And then, how about other activities? Does she cough at night? Does she get breathless with these things? Does she have other signs and symptoms that present more characteristic of a uncontrolled persistent asthma? Tapos, by the way, lumalala lang siya kasi nga,
Napagod.
siya. So, napagod siya, parang ganon. By the way, ang sagot doon ay hindi wag paglaruin.
Pwede pa rin maglaro ang asthmatic, di ba?
Correct. Pwede
silang or players, di ba? Gymnasts and all varsity players, no? So it's not a contraindication.
Yes, correct. So you just have to control the underlying asthma. They might need maintenance medicine. They might need a medicine prior to sports. They might need more warm up because they'll say warming up before sports makes you less likely to get an attack. So all of these things you'll get to discuss with your doctor. Pero
Dr. Rachel, sorry, you mentioned kanina coughing at night. Perfect, because Ms. Rose, I think this is a follow-up question. Coughing at midnight, waking up, coughing at night. So for several days, is this also allergic? Could be allergic or?
If it's recurrent, pagpabalik-balik, maybe it's not. Maybe it is allergic. Maybe it's allergic or asthma. Di ba in asthma in children, we always ask, does it disturb sleep? Kasi that's part of the symptomatology. So yes, if it's pabalik-balik po, Ma'am Rose, baka nga mayroong asthma or parang post-nasal drip, like when they lay down, tapos all their mucus goes to the back of their throat, kaya pala umuubo, so baka allergic rhinitis. So the chronicity, the recurrence of the symptoms is important to talk to your doctor about.
Thank you, Dr. Rachel. From Ms. Eunice, recommended po ba ang humidifier for cough and colds as home remedy? So parang nabanggit ito kanina ni Marites, ano? And para makahinga ng maayos si baby kahit papaano.
Yeah, I guess, di ba, siguro, parang gano'n na rin nga, I told you, di ba, parang lumuwag yung upper airway or dito sa may bandang ilong, sa taas ng mga lalamunan. Pwede, sometimes can help. But again, if it's really bad na nahihirapan huminga na maayos ang baby, lalo na kung baby, no, less than 1 year old, I guess, best is still to consult again your doctor. Kasi I guess, if I may, parang binigyan daw Michelle ng allerkid, yung baby. Depende, no?
Antihistamine.
Yeah, ang assessment is an allergy.
Ang naisip.
All right. So one more question from our Facebook participant. Hello po, my daughter is 5 years old. She has asthma. Lately, I've noticed that she is having a dry cough at night, but during the day, she is fine. So parang ano din to, no, may time preference. Binigyan po siya ng antihistamine when it attacks at night and it works. Is it safe to give cetirizine every night? Or how long is it safe to use? So perfect for both of you po, Doc Emily and Doc Shell.
The cetirizine is safe. It's a safe drug. Generally, antihistamines, not just cetirizine, are safe. But, like everything else, medicines are medicines are medicines. And I think the first thing that we have to address is what is the underlying problem? Ano bang problema?
Agree. What is the
Diba?
underlying cause?
Oo. So, kasi, kunyari, hindi natin na-address yung underlying issue, kahit siguro magbigay pa tayo ng magbigay ng cetirizine, baka it might not, even if it's safe, it might not be effective naman.
Yeah.
The asthma the pulmonology doctors will say, paggabi, umuubo, baka nga asthma. So, I think that's something,
True.
diba?
Yes,
Pwede
yes.
pa rin.
So kailangan talaga, Doc, no?
Ay, at
Pag-usapan
saka,
ng doctor.
ang antihistamines are not medicines for asthma, by the way, ha. So, kunyari may asthma parang kasi some people, they use it as their rescue medicine. Parang may asthma, bigyan natin ng antihistamine, parang ganon. So, baka hindi mag-work.
Alright. So I'm sure marami pang gustong magtanong, but I will ask po this last questions from Stephanie Joyce Angeles. Hi po, ask ko lang po kasi yung baby ko, isa po sa symptoms niya kapag uubuhin or sisipunin is bahing na ng bahing. Ano pong pwede ipainom na gamot? Ayan.
Dr. Michelle yan.
Yan yung cetirizine. Kung sneeze ka ng sneeze, tapos pabalik-balik, tapos sipon ka ng sipon, tapos wala nang ibang other symptoms, Ma'am Stephanie, maybe it is allergic rhinitis. And then if you have a family history pa of everyone being allergic, etc. And so your doctor, your pediatrician or your allergy doctor or your doctors might, if they think it's an allergic problem, if it's allergic rhinitis, certainly baka antihistamines, they'll try an antihistamine. If it's not enough, there are other medicines that your doctor can give depending on how old your baby is. So pwede ba siyang mag-spray or things like that? Dapat na bang hanapin kung ano ba yung nagpapa-allergy sa kanya? Kasi hindi nawawala despite the medicines. So so talking to your doctor about it would be good. But
Thank you.
Antihistamines are great kasi they're easy. Emily's correct. Parang lahat na lang ng tao naka-antihistamines ngayon.
Yes.
Thank you very much. All right. So thank you to our audience for typing in and sending your questions. May I ask our speakers, our expert speakers, Dr. Emily and Dr. Rochelle, for your parting words or advice to our audience.
Yes. Okay. Thank you again. Thank you again to all of you for attending our webinar this morning. So, siguro one word of advice. I know, again, as I mentioned, that cough may be bothersome. Sometimes you get worried about it. School is about to start. I think started in some schools already. So, again, 6 to 8 times in a year, pwede talaga magkaroon ng ubot-sipon ng bata. So, we just need to address the cause. But more importantly, of course, Michelle, is
all the other warning signs or the red flags that we talked about. So, pati yung mga questions nyo, ganon diba? Meron bang difficulty of breathing? Meron bang other signs and symptoms? Meron bang failure to thrive? There are other physical findings that you see that accompany the cough and is not getting better or in fact is getting worse despite all your ministrations. I think that would be time to see your doctor. I don't think there's anything wrong about asking your doctor at any time, diba? Tinanong namin kayo about timing, but anytime, so long as you're worried, so long as these red flags are there, I think it's good. It would be a good thing to see your doctor or consult with them.
Thank you very much, Dr. Emily and Dr. Rochelle. I truly enjoyed and learned a lot from our session this morning, and I cannot thank you enough. Until our next Institute of Pediatrics Learning Academies, Coffee and Conversations. Thank you, Dr. Emily, Dr. Rochelle. All right. So, to all our participants, Again, thank you for joining us this morning. For your certificate, you may scan the QR code or click the link on the chat box. I will return to this slide in a while. For inquiries about our speakers, Dr. Emily Resurrection and Dr. Michelle De Vera, and other pediatricians and specialists at the Medical City, please contact the Institute of Pediatrics with this number. And just a reminder to all our parents, aside from COVID-19, there are many more vaccine-preventable diseases, especially in this upcoming rainy season. Please continue to observe minimum health standards and visit your pediatrician to get your children's vaccines updated. I would like to invite you to our upcoming webinar. On August 26th, Saturday at 9 a.m., we are inviting you to another webinar for Coffee and Conversation entitled Paunang Lunas, Siguradong Ligtas. Learn about basic emergencies a child may encounter at home and in school, together with the first aid treatment you can give as their caregivers, with our experts, Dr. Diane Fabellion and Dr. Jojo Matibag. Register for free by scanning the QR code. Again, thank you for spending your morning with us today for the Institute of Pediatric Learning Academy's Coffee and Conversation. I leave you with a link to the certificate. This link will only be available until 5 p.m. today. See you in our next webinar. This is Dr. Milay Balilichua for Coffee and Conversation of the Medical City Institute of Pediatrics, your partner in pediatric healthcare. Good morning, everyone, and stay safe.